Today we are here as a COVID-19 steering committee chaired by His Excellency the Governor and co-chaired by the County Commissioner, discussing on ways to mitigate the COVID-19 infections that have risen in our county. We have had meetings this morning. We have had lengthy discussions and have come up with several deliberations and several way forward.
On behalf of the business community, as a chair, I want to encourage members of the business community to observe all the protocols, avail the sanitizers, the soaps, and the mask to the public or to members of staff so that we can seriously contain this disease. This disease is more deadly, it's more infectious, and we have to take all the necessary measures.
The new strain is wiping and killing. I really want to urge all of us. We are Kenyans. We have the responsibility that has already been indicated under the Ministry of Health guidelines. Let's ensure we wash our hands. Let's ensure we mask. Let's ensure we social distance. All these are basic things that can really mitigate the spiraling pandemic.
The infection rate is rising countrywide, but we are more worried as a county because during the first wave and the second wave, we were ranked as role models. We were very effective in ensuring that we adhere to the protocols that have been set in place, but this time round, we are not doing well. And therefore, they informed us to have this meeting so that we can address gray areas that we think are the main cause of the surge.
In MTRH, as we speak for now, our isolation is full. And we have no other facility really to transfer all these clans to. The only best way is how best can we combat the pandemic at our levels.
It's our commitment as the security players to work more extra than before to ensure what we have agreed or what we have resolved as a committee we will put in place. But it's also important to mention we are also going further to ensure we have also involved, and particularly those people who are at the village level, the chiefs who are there, to ensure the protocols that have been given out by the ministry, they are adhered to.
As it stands now, Uasin Gishu has over 4,234 infections. That's a very big number. And we are not worried of the number that is known. We are worried of the numbers that we don't know. That means the continuing community infection. And this is the number that is a threat to everybody. Remember very well that the third wave of the pandemic is not giving the original symptoms. The new variant or that is propelling the third wave, the signs, the symptoms are totally different. Some are treating malaria, some are having running stomach, some have other challenges that are totally unrelated to how we had been made to believe. And this is why a number of people are taking self-medication at home, thinking that they are attending to a common challenge. But it comes too late when they discover that they are contracted the COVID-19. And therefore, we are urging the residents of Uasin Gishu, when you get any medical challenge, instead of doing self-medication, go to an health facility to be tested. Because all symptoms now could be an indication that you could be having the disease. And one way, a sure way, that will guarantee our safety is to adhere to the public health protocols that have been given. If you adhere to those, you are going to win this war. The third wave began in March, and we are told it takes 3 to 4 months. So we can say we are not even halfway. And therefore, adhering to the protocols that have been given is a must. And as a county, we are working with the multi-agency team to enforce what has been set by the public health for the safety of the people of Uasin Gishu. We have noted areas of interest are public service vehicles, where today we have reintroduced Sambasa, and matatus are carrying more passengers than what had been advised. And by this, we have asked the police to swing into action, and all those who are breaking those rules will have to be taken to court. This includes border. It had been made very clear that border riders must, the rider must carry one passenger. But what we are seeing today is that we have gone back to normal. And knowing very well that people have to restrain themselves by sharing one spot to support yourselves, then it becomes the weak point. Banks, supermarkets, bars, clubs, and hotels have breached the protocols given, where people are supposed to sit in 2. They have reintroduced another 2 seats. Therefore, social distancing has been challenged. Churches are overflowing. And that's why we are urging church elders and in the villages, the chiefs, to intervene and ensure that the sitting arrangement is followed. People above 58 can conduct their prayers from home. In any case, burials and political gatherings, the president has pronounced there are no political gatherings. And that's final. You don't amend a presidential directive. It is the giver who does the amendment. So if we do that, we are going to succeed. The same with the burials. The people must social distance and maintain the minimum number given. And we want to urge our residents, kama wewe haukuwa unamtembelea mtu wakati yako hai, unataka kwenda kufanya nini wakati amelala? Just say pole na tungoje siku ya kiyama. Going in thousands is not a sign of respect. But showing respect to somebody is when you are still alive. Go and say hello to him. Pelekee maua. Najua sisi wa Afrika tunapeleka maua siku ya mazishi. Wazungu wanachukuanga maua wakiwa hai. Na wakikufa wanasema we are not in, hatuhitaji maua. You have seen people saying we don't need flowers. It's because why take a flower to somebody who doesn't know? We want to know the meaning of some of these things so that things work well. So the committee deliberated that we are going to map out areas with challenges of infection. We are going to enforce multidisciplinary team to ensure the protocols are followed. We are going on in creating the public awareness, and we want this to be the role of everybody. Ukipata watu wamejikusanya na wamekaribiana sana, unaambia please, COVID is real, songa kando. Kama mtu anataka kuzungumzia na hajavaa mask, aambia kama ana mask kwa mfuko, aende 20 meters na shout. To shout so that you can listen. Otherwise, you kukaribiana, mnasambaza ugonjwa. And this public awareness will be carried out by the Office of the Governor and the Office of the County Commissioner. Also, we have agreed to improve contact tracing, so that for the case where there is somebody known case, then contact tracing follows the protocols that have been given to ensure that we are able to bring on board those who may have come in direct contact with the victim. The health department will enforce the 72-hour burial time allowed for all those who have passed on. The county commissioner's office and the police will enforce political gatherings. Sio tu ile wanasiasa wana address, hata raia wanakuanga na bunge la wananchi katika town. And they argue for issues that are very far from them. Kutoka asubuhi mpaka jioni. Mwingine anasoma one sentence kwa gazeti na kuanza ku-elaborate. Ni kanisa tu watu wana-emphasize a verse. Lakini kwa siasa tuache. Especially where we bring people very close to each other. Community sensitization should continue. Na mwisho, tumekubaliana kwamba we want to encourage people to go and receive the vaccination. Enda upate chanjo. Mimi mwenyewe nimepokea yangu. Na hakuna madhara ambayo tumewahi kusema ati ulisikia namna hii. Nilimaliza na nikaendelea na kazi. On the third day somebody was iko namna gani, nikamwambia hata nilisahau kwamba nilifanya nini? Nilipata chanjo. Na mimi nataka kuambia kama nyinyi mnakubali hii ya kienyeji hii inabebwa na wazee wengine hapo town. Kila saa ukifika anaanza kufanya namna hii na unameza. Hata ujui ni miti gani imekaa siku ngapi? Kama unakulanga Panadol ama unakunywa ino wakati umekula vinono, hii ingine haina shida na haina madhara.